From San Francisco, it's Grumpy Old Doc with Dr. Gene Bede.
Hello, this is Dr. Gene Bede, and welcome to a very special edition of Grumpy Old Doc. As we are recording this, Houston is in the midst of at least a century storm. People are displaced everywhere. Flooding is devastating. The city of Rockport, a little bit to the south, has been destroyed. In the middle of this flooding, I wanted to do a special show talking a little bit about this specific disaster, as well as when one happens, what steps you should take. So on the line with us today, we have an emergency room doctor from the Houston area who has been working continuously at the hospital for the last couple of days. I'd like to welcome to the show Dr. Mallory Bede. Mallory, you want to tell us a little bit about who you are and what you've been doing over the last couple of days?
Absolutely. So I am an emergency medicine physician, and I work over in the Woodlands area, which is the area north of Houston. So we've been having a significant amount of flooding and rain in the past few days, and I have spent over the past 30 hours in the ER just due to difficulty of getting other physicians in, working around the clock to provide care to our community.
So right now, does the hospital have electricity? Are ambulances able to get in and out of the hospital?
We have been blessed that we've had electricity during our entire time that we've been open. Ambulances are now being able to get in and out of our parking lot. We did have a period of time yesterday where we had such significant flooding that not even the ambulances were able to bring patients to the hospital. No flooding yet. There have been a lot of flooding into the actual hospital, but there's been flooding all around it. Seems like the roads are starting to finally clear up. And then we've been open for business, but we've been blessed by our administration who kind of planned ahead for this disaster and brought several nurses and staffing members who've been staying at the hospital and living there and then showering, sleeping, waking up, and working. And they've been there for the past 3 days and may be there until the end of this week.
Wow, I hope they get some good overtime or at least a nice little plaque or something. What about the integration of the emergency medical system? You said you weren't able to take patients for a while. I imagine there's other hospitals that either face the same thing or even worse. And how do you communicate between and among the various emergency rooms and the emergency medical technician paramedic system to make sure they're not trying to get to a hospital with a very sick patient that they're just not going to be able to get to?
So the communication between EMS and the ambulance and the hospitals is really great. They know exactly what hospitals that are easy to get into, which ones are open, which ones are flooding during these disasters, and they're always in communication with us with a radio. And for some reason that we aren't able to accept patients, they call us and warn us about a patient, and if we're unable to accept them, we're able to divert them to other places that are available, which is great. In terms of the different hospitals, it's a little bit more difficult to have that kind of communication. We, as St. Luke's, have a bunch of sister hospitals around, so we're always in communication. But places like Ben Taub, downtown, that are getting evacuated, we're hearing about with the rest of the community on the news and accepting any evacuations that we can that are reasonable.
So just trying to be very flexible and staying informed. How about other facilities like nursing homes or places like that may be in low-lying areas, and they got to get people out?
We have not been seeing that at this point in time. We have a lot of plans in place. We're working with the local community to find shelters so that people who may not be able to stay inside where they're at but are not having emergent medical conditions, we are able to direct them to different places where they can stay safe and dry. We also have a social worker who's been great and working around the clock to help us find places and get cab vouchers and transportation for people to different areas.
Anybody get stuck in the emergency room? Anybody come there and now they can't get home?
We have been lucky enough not to have any of those issues as of yet. Most of the people have been able to get in or out. We have plans, though, for that we will allow anyone who comes into our ER who's not able to leave We will allow them to stay in our lobby, and we will provide them with food and all the capabilities that they need. Unfortunately, we're unable to offer beds to people who come in and are unable to get out because we just don't have those resources at this time. But absolutely, we are providing their basic needs if people can't leave.
How about unique flood-related injuries, visits? I know there's been one drowning, and I would imagine the drownings will be relatively scarce, but are you seeing other sorts of injuries that are relatively common to floods and hurricanes?
We are seeing some slip and falls due to the weather outside, and we did see a rib injury yesterday with a fractured rib from people trying to repair their drywall. But we've also seen a couple people come in with fire ant bites because they're out in the weather trying to protect their home and ended up getting bit by several fire ants.
They're nasty. They float on the water. I have a picture I'll post on the Grumpy Old Doc website and Facebook page. They look like a handful of coffee grounds. They make a raft and they float on each other. Terrible, terrible things. Are you seeing folks coming in maybe to the emergency room and maybe risking their life to get there or risking their life to get home for conditions that perhaps they shouldn't go to the emergency room for?
Oh, absolutely. We're seeing a lot of people come in for things like wrist pain for the past week and colds and coughs and constipation and rashes. So we're seeing people come in, and I know it's a scary situation and it's sometimes difficult to assess whether you should go to the ER or not. But I do want to remind people that we are limited on our resources, including our doctors, our nurses, but also just in everything, medications, and coming to the hospital during these times with non-emergent conditions is really putting a strain on all of our medical workers.
Any critical supplies that are running short in terms of drugs or other necessary types of things?
We are running low on isotopes for our nuclear medicine scans, so things that need things like a HIDA scan or a VQ scan, if people know what that is. Those are some fancy terms. We're running out on that. We're also running out on some very specific antibiotics that are for very serious illnesses and infections, and we're running low on those supplies in itself, and just because of the flooding, we're having difficulty getting anyone to transport extra supplies in. So that's another thing we want people to be cognizant about coming to the ER, is that it's difficult for us to be providing a lot of extra things for people and know that it is truly a strain on our resources right now.
Well, you know that I believe that today's docs do too many scans and prescribe too many unnecessary antibiotics anyway, so I'm not going to worry about it. No, seriously, I understand what you're saying. Sometimes those things are really necessary, and sometimes they're magic. So people shouldn't come to the emergency room for minor things. They got a cold, they've thrown up a couple times, a little dyspepsia, some constipation. But it's hard to know. I used to always say, my definition of an emergency is something that I need. My definition of a non-emergency situation is something you need. Seriously, what kinds of things should people, they should just say, I'm going to need to call an ambulance, 911, get to the emergency room. I shouldn't sit at home and talk myself out of this. This is serious, even if there's a flood outside.
Yes, absolutely. Things like stroke-like symptoms are things
so that means all of a sudden your hand goes numb or you can't move your fingers. People sometimes don't know what that means. They say, I didn't know I was having a stroke, just my fingers stopped working on my left hand. That would be an example.
Absolutely. Yes, and if people are experiencing stroke-like symptoms, that's something that is time-sensitive. So if you're having stroke-like symptoms, it's something you absolutely should not wait for. You should call
because there's medicines they can give you that will limit the extent of the stroke and the damage and the subsequent need for rehabilitation, learn how to walk, learn how to talk. All that stuff may be able to be minimized in some folks with prompt treatment.
Correct. On top of that, there are other things like chest pain, and someone who has a history of cardiac problems, heart problems, should really consider about calling EMS immediately. Difficulty breathing, someone who's been in worsening pain and vomiting, you're unable to keep down any food or liquids, and you believe you might have a need for surgery of your abdomen. Those are reasons to come in. Most other things I would think really hard about coming in the ER, and there are other resources that people can be utilizing during this time.
Obviously, trauma, bleeding that you can't stop, a broken bone, someone that's knocked out, particularly old people. If they fall and slip, you were saying you had a few people falling and slip. Old people can be at increased risk for bleeding in their head with what might seem like a relatively insignificant head injury at first. If I'm an old person and I knocked my head, somebody should be keeping an eye on me, and if they see me getting sleepy or bad headache or anything else, man, I got to get in too.
Yes, and especially if you're on any kind of blood thinner, it's also one of those things that increases the chance of possibly a bleed in your brain, and you need to seek an evaluation more so than if you were not
decided to go for your best based on an ad on television. Going for your best may include taking a medicine that may be difficult to reverse and may increase your chance of bleeding. Make sure your doctor has told you things like that. While we're talking about drugs on television, I'm going to go get a refill of my high blood pressure medicine pretty soon, and I can't get it. It's a Tenolol. Are you guys able to get a Tenolol down in Texas?
You may know more about prescribing long-term medications. We in the ER always do our best to provide people with short courses of medicine. And it's best to talk with your primary care doctor if you're running out of your medicine to always make sure you have a backup supply. But in terms of the ER, right now we're having even a difficulty having our local pharmacies be people to pick up their normal medications. So if you're in the hospital, and we've been dealing with this, is that we've been talking with our pharmacy who's been really great about giving at least a 2-day supply for anything that's been based as a life-saving medicine, that we will be willing to dispense people medications just for a short period of time to get them through.
Vicodin, Dilaudid, Percocet, you're going to be OxyContin?
No narcotics are being dispensed from our emergency room as from our pharmacy directly. Those things are not being given out. If you are in such significant pain that you cannot go home with anything else, then those are people who may need to be admitted for observation.
A couple of points, and I'd like to make some of these points about chronic medicines. And like I said, I have high blood pressure medicine. I buy it generic, and I buy it by the bucket, and so I have a few hundred days on hand. Not only for an emergency, but what I was specifically referring to is Atenolol is made by 6 manufacturers in the United States, and right now none of them are manufacturing any of it, and it is out of stock at virtually every pharmacy in the country, and people whose blood pressure has been stabilized on Atenolol are going to have to find some other beta blocker or medicine to take. But if you're on chronic medicines, you should have a couple of weeks' supply at home to get you over. Couple of ways to do this. Perhaps your doctor will willing to prescribe for you and state that it's an emergency supply. If that gets rejected, you can state it's a vacation supply. You're going overseas for 2 weeks and you need that, and see if that works. Maybe he can give you free samples. Maybe you can shop around at places like Costco and get a better deal at buying it, particularly if it's a generic. Some people will actually go overseas to get an emergency supply of medicine. The other thing is, if you can refill your medicines early at all, do so. If you get on a monthly automatic refill, most retail, you'll end up with a few extra pills every few months, and you could start to store them and stockpile them a little bit. Having a list of all your medicines so that if you run out, you know what you should be on. Having a backup supply of all of your medicines. Obviously the things like food and water. From a medical perspective, any other things people should be doing and they should have at home to prepare themselves for a natural disaster.
I think that people can just have a basic medical kit at home, including bandages, alcohol wipes, Neosporin, antibiotic ointment, anything like that would just be great around the house for small cuts. And I think, again, to have a backup supply of anything that you might need, including medications, but that also includes things like your peritoneal dialysis patient to stock up in case of a natural disaster of extra dialysis. But again, I think you hit the nail on the head by saying make sure you stock up on food and water and canned foods or all other things that people should be aware of in preparing for natural disaster.
Are there people that absolutely positively need electricity in their homes, or some piece of equipment that's life-sustaining will not work? Should those people be planning on evacuating? What's the best course of action if I'm dependent on electricity and I'm in a place where the power is likely to fail?
I would definitely think about evacuating early in those situations. Also contacting shelters And then in the hospital, we've also created our own little plan that if people do not have a current emergent medical condition, but say you are running out of your oxygen and you're a chronic emphysema patient,